Understanding high blood pressure, rethinking medications, and exploring natural approaches. Introduction. High blood pressure or hypertension is a growing concern worldwide, with increasing numbers of people receiving diagnoses each decade. However, this trend is not solely due to rising health risks. It is largely influenced by lowering diagnostic thresholds for hypertension, meaning more individuals are now classified as having high blood pressure, despite limited evidence that treating these lower levels significantly reduces mortality rates. While managing blood pressure is critical for preventing heart disease and stroke, many blood pressure medications come with side effects that may be overlooked or misunderstood. This article explores the complexities of blood pressure management, reviews the potential risks associated with commonly prescribed medications, and highlights evidence-based natural approaches that may offer safer alternatives for maintaining cardiovascular health. Disclaimer. This podcast is for informational purposes only and does not substitute professional medical advice. Individuals with high blood pressure or other cardiovascular conditions should consult with a qualified healthcare provider before making changes to their treatment plan. The changing definition of high blood pressure. Historically, the standard for diagnosing hypertension has shifted over time. In 2017, the American College of Cardiology and the American Heart Association redefined high blood pressure as anything above 130 over 80 millimeters of mercury, down from the previous threshold of 140 over 90 millimeters of mercury. This change led to nearly half of U.S. adults being categorized as hypertensive overnight, significantly expanding the number of individuals eligible for treatment. However, no compelling evidence supports that treating individuals with mildly elevated blood pressure, 130 to 139 over 80 to 89 millimeters of mercury, reduces the risk of death or major cardiovascular events. Critics argue that lowering diagnostic thresholds has led to overtreatment with medications that may provide little benefit for those at lower risk. The hidden risks of blood pressure medications. First, beta blockers. Beta blockers such as metoprolol and atenolol are commonly prescribed to manage high blood pressure by slowing the heart rate and reducing the force of heart contractions. While effective in certain situations, beta blockers can cause fatigue, depression, dizziness, and sexual dysfunction. Prolonged use may also contribute to insulin resistance, increasing the risk of developing type 2 diabetes. Second, ACE inhibitors, angiotensin-converting enzyme inhibitors. ACE inhibitors, such as lisinopril and enalapril, work by relaxing blood vessels to reduce blood pressure. However, they often lead to chronic cough, dizziness, and electrolyte imbalances. In rare cases, they can cause angioedema, a potentially life-threatening swelling of the face and throat. Third, ARBs, angiotensin II receptor blockers. ARBs, such as losartan and valsartan, are considered safer alternatives to ACE inhibitors because they do not cause a persistent cough. However, they may still contribute to dizziness, kidney dysfunction, and elevated potassium levels. Recent concerns also highlight potential contamination of certain ARB medications with carcinogenic impurities. 4. Calcium channel blockers. Calcium channel blockers, including amlodipine and diltiazem, prevent calcium from entering heart and blood vessel cells, relaxing the blood vessels. These medications may cause swelling in the legs, dizziness, constipation, and headaches. Long-term use has been linked to an increased risk of breast cancer in some studies. 5. Diuretics. Diuretics, commonly known as water pills, reduce blood pressure by eliminating excess sodium and water from the body. While effective in lowering blood pressure, they can lead to electrolyte imbalances, dehydration, and an increased risk of gout. Diuretics may also contribute to low potassium levels, causing muscle cramps and heart arrhythmias. The risks of overmedication and excessively low blood pressure. While aggressively lowering blood pressure can reduce the risk of stroke and heart attacks in high-risk individuals, excessively low blood pressure can be harmful, especially in older adults. Blood pressure that is too low may lead to dizziness and falls. Low blood pressure increases the risk of falls and fractures, particularly in elderly individuals. Reduced organ perfusion, insufficient blood flow can impair kidney and brain function, increasing the risk of kidney damage and cognitive decline. Increased risk of mortality. Studies show that overly aggressive blood pressure reduction may paradoxically increase the risk of death in certain populations. Evidence-based natural approaches to manage blood pressure. 1. Adopt a heart-healthy diet. A Mediterranean-style diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats has been shown to reduce blood pressure and improve overall cardiovascular health. This diet emphasizes nutrient-dense foods that provide potassium, magnesium, and antioxidants, which help regulate blood pressure naturally. Increase potassium-rich foods. Potassium helps balance sodium levels and reduce blood vessel tension. Include potassium-rich foods such as avocados, spinach, sweet potatoes, and bananas. Limit processed foods. Processed foods high in sodium and refined sugars contribute to inflammation and elevated blood pressure. Reducing sodium intake to under 2,300 milligrams per day, or ideally 1,500 milligrams, can significantly lower blood pressure. 2. Optimize magnesium levels. Magnesium supports relaxation of blood vessels and regulates blood pressure. Studies show that individuals with higher magnesium intake have a lower risk of developing hypertension. Magnesium-rich foods include almonds, pumpkin seeds, leafy greens, and dark chocolate. 3. Increase omega-3 fatty acids. Omega-3 fatty acids found in fatty fish like salmon, sardines, and mackerel have anti-inflammatory properties that support blood vessel health and lower blood pressure. Supplementing with high-quality fish oil may also reduce systolic and diastolic blood pressure. 4. Engage in regular physical activity. Exercise strengthens the heart and improves vascular flexibility, reducing blood pressure over time. 150 minutes of moderate-intensity aerobic exercise weekly, such as brisk walking, swimming, or cycling, can significantly improve cardiovascular health. Practice stress management techniques. Chronic stress contributes to high blood pressure by elevating cortisol and triggering inflammatory responses. Incorporating stress management practices such as meditation and deep breathing activates the parasympathetic nervous system, promoting relaxation and lowering blood pressure. Yoga and Tai Chi improve flexibility, circulation, and mental well-being while reducing stress hormones. 6. Support mitochondrial health. Mitochondrial dysfunction is increasingly recognized as a contributing factor to hypertension. Protecting mitochondrial function by reducing oxidative stress and enhancing ATP production can improve vascular health and normalize blood pressure. Key strategies include supplementing with CoQ10 and alpha-lipoic acid. These antioxidants protect mitochondria from oxidative damage and enhance energy production. Avoiding seed oils and processed foods. Seed oils rich in linoleic acid contribute to inflammation and mitochondrial dysfunction. Conclusion. Managing high blood pressure effectively requires a nuanced approach that goes beyond simply lowering numbers on a blood pressure monitor. While medications may be necessary for some individuals, they often come with side effects and potential long-term risks that should not be overlooked. Natural approaches, such as adopting a nutrient-rich diet, increasing physical activity, managing stress, and supporting mitochondrial function, provide safe and effective alternatives for maintaining healthy blood pressure. By addressing the root causes of hypertension and promoting overall cardiovascular health, individuals can reduce their risk of chronic disease and improve long-term well-being.